The cosmetic industry is rapidly changing, and if you haven't already learned about using natural filler made from your own body, then you have to watch this video. My name is Dr. Swati Cannon, and I am a cosmetic dermatologist out here in California. I have been using natural filler called PRF or platelet-rich fibrin for the past 1.5 years, and I have been getting some excellent results for my patients. Stay tuned till the end of this video because I'm going to show you some great before and after photos and also go through my approach when it comes to creating a treatment plan for each patient. By the way, this video is part 1 out of 3 where you're going to learn all about the different kinds of fillers. So this part 1 is about PRF, part 2 will be about hyaluronic acid fillers, and part 3 will be about other biostimulatory fillers. So make sure you hit the subscribe button so that you can stay up to date. First, let's talk about what PRF is. PRF stands for platelet-rich fibrin. And when you first hear the term PRF, you might be thinking about PRP. PRP stands for platelet-rich plasma. And while they are both pretty similar, there are some differences between the two, which then dictate where we use PRF and where we use PRP. Commonly, we use PRP for not only skin rejuvenation, but also for hair growth. And while PRF can also be used for those two things, I tend to use PRF more as a filler, and I tend to use PRP more for hair growth. PRF or platelet-rich fibrin is basically a concentrate of your blood that is composed of platelets, fibrin, and white blood cells. These are all superheroes when it comes to tissue regeneration and healing. I would label PRF as a biostimulatory filler, but it's so much more natural, so I think I like to call it a natural filler versus a biostimulatory filler because I don't want to confuse PRF from other types of fillers. PRF was originally described in dental journals where they used the fibrin PRF clot for improved tissue regeneration during their dental procedures. It then started to become implemented within cosmetic and regenerative medicine. I have been using it, like I said, for the last 1.5 years and have been really impressed with the results. How does PRF actually work? In order to understand how it works, we first need to understand what role platelets play in our body. So when we first cut the skin, meaning when you first get an injury, the platelets are the first cells that get recruited to the site of injury. They help to form a blood clot so that you don't keep on bleeding. Platelets also contain a bunch of growth factors. Once platelets arrive to their destination, which is the site of injury, they then release a ton of growth factors, which then promote blood vessel formation, healing, collagen generation, etc. So the growth factors that platelets contain could be studied for lifetimes. But the main growth factors that we want when it comes to tissue regeneration is VEGF, which is vascular endothelial growth factor, TGF-beta, PDGF, which is platelet-derived growth factor, fibroblast growth factor. All of these are useful when it comes to collagen regeneration, as well as elastin regeneration. PRF also contains fibrin, which is a protein that creates like a mesh or a scaffolding to stabilize the clot. When we create a scaffold, it allows for tissue regeneration to happen at the area where there's a scaffold. So that's why not only are platelets important in the PRF, the fibrin is also important because we want to have tissue regeneration in a localized area, not all over. The last thing PRF contains is white blood cells, and white blood cells are helpful not only to fight against infection, but they also eat up all the bad tissue and they boost the healing process. So PRF takes all of these 3 different elements, combines it into a gel, and when we inject this gel, we can cause localized tissue regeneration exactly where we want it. It's like delivering a package of tissue renewal right at your skin's doorstep, and I think that whole concept is just so freaking cool. So if you are as enthralled by it as I am, please comment below and let me know your thoughts on natural filler. Would you use it? Are you interested in using it? Let me know your thoughts and comment below. So how do we get PRF from your blood? Well, we first start by drawing some blood into tubes, and this is very similar to how you would get a normal blood test. I draw your blood. That blood in tubes is put into a centrifuge machine and spun at very high rates. The centrifugation process then separates the red blood cells from the platelet-rich fibrin. So the red blood cells settle at the bottom and the platelet-rich fibrin is at the top. I then very carefully and gently extract out the PRF into syringes, and I will inject the PRF usually under your eyes to fill those tear trough or the hollows. Taking PRF a few steps further, we can actually create something called EZ-Gel. EZ-Gel and PRF, while they are similar, EZ-Gel is a little bit different, and it's different in the way we produce the EZ-Gel. So the name actually comes from the company that came up with the process to make the EZ-Gel. So PRF just by itself, that is what I inject under the eyes. It is a little bit more liquefied, and as we inject it, it becomes more gel-like. EZ-Gel, though, has a consistency more similar to filler, and therefore we can inject it into thicker areas of the skin, not only giving it a plumping effect, but also causing tissue regeneration. The way we make EZ-Gel is, I already talked about how I made PRF. I then take a second tube of your blood and I spin that down even faster than we spun the PRF. Spinning the blood at higher rates makes the red blood cells go at the bottom, and now at the top you have platelet-poor plasma. This means that the plasma has very few platelets, but it contains a protein called albumin, and albumin is something that you naturally have in your body. When we extract this platelet-poor plasma, which contains albumin, and we heat it and cool it, it now creates a very nice gel. To create EZ-Gel, I now mix the albumin gel with the PRF, and it now allows the PRF to be in a gel-like consistency, which can be more easily injected into thicker layers of the skin, including areas like your nasolabial folds, your marionette lines, your temples, your cheeks, etc. EZ-Gel is a natural biostimulatory filler. By the way, stay tuned for my upcoming videos on fillers and Botox, because for most patients, I use a combination of different treatments. I'll use PRF, hyaluronic acid fillers, biostimulatory fillers, as well as Botox to give the result that we need. So the next series of videos will address a lot of common questions and concerns that are associated with fillers and Botox, so hit that subscribe button to stay tuned. Right now, you're probably thinking that the process of extracting PRF sounds a lot like PRP. And so what exactly is the difference? Platelet-rich plasma and platelet-rich fibrin, they are autologous treatments. That means that they are derived from your own body and then injected back into you for healing purposes. However, PRP and PRF differ in the way that they are constituted and in the way that they are prepared. So PRP is also made by spinning your blood pretty rapidly in a centrifuge machine, creating platelet-rich plasma, which is then extracted. However, PRP contains anticoagulants. That means it doesn't allow that platelet-rich plasma, it doesn't allow it to clot. So when it's injected, the growth factors are released almost immediately. And this rapid release of growth factors can lead to a shorter duration of action. On the contrary, the PRF contains no anticoagulants. So it contains all of the clotting factors you need to create a clot along with the platelets. So when PRF is injected, it allows for natural coagulation. This results in a gel-like fibrin matrix, rich in growth factors, which are then released over a much longer period of time, usually 3 to 5 days. This prolonged release then leads to a more sustained tissue regeneration. The most common area that I use PRF is for tear troughs, or the hollows under your eyes that contribute to that tired or fatigued look. And as I mentioned in 2 previous videos, the first video talks about why we get under eye circles, and the second video talks about eye creams. But as I've mentioned in these videos, the eyelid skin is incredibly thin and usually shows the first signs of aging. And yes, eye creams help a little bit to hydrate the skin, but eye creams are not as powerful as in-office procedures that we can do to help with under eye circles. So that's where PRF has been coming into play in my office. I now use it way more than tear trough filler to fill the hollows under the eyes. It has really changed my game plan for how I approach dark circles, tear trough hollows, and skin laxity. So traditionally and in social media, a lot of emphasis was placed on using like hyaluronic acid filler to fill the troughs under your eyes. And almost immediately when you see the before and after photo looks amazing and the troughs are filled. But 3 or 6 months down the road, a lot of patients would begin to see swelling because the filler would either get displaced downward or it would retain so much water that you would get swelling in the area, and that looks almost just as bad as having hollows in the area. But PRF has none of those issues. It doesn't retain water, it causes natural collagen stimulation and helps to fill those hollows without the other problems that we have with hyaluronic acid fillers. So at this point, you're like, cool, PRF this, PRF that. How exactly does it help my under eyes? So all of those growth factors that we inject, those are released over a period of 3 to 5 days. Those growth factors then allow for collagen and elastin formation. When we produce collagen and elastin in the area, it can, 1, help to reduce the bluish discoloration that can happen because the blood vessels are too prominent. It also helps with decreasing discoloration hydration in your under eyes. It can help with skin laxity, fine lines, and wrinkles. So collagen stimulation really helps with all the different problem areas when it comes to under eye circles. And because PRF also helps with wound healing, I tend to combine PRF with other treatments like laser resurfacing, radiofrequency with microneedling, chemical peels, or something called Tixel. Since PRF not only helps with skin laxity, but also helps to volumize the area. If patients have severe tear troughs where I know that they're going to need a hyaluronic acid filler down the road, I will still complete the series of PRF treatments because I know that this will improve the skin quality. And then I will do tear trough filler later on. This is beneficial for multiple reasons. One, when we improve skin quality, the tear trough filler is more likely to stay put and not be displaced. Second, because there's already some volume replacement from the PRF injections, I would then need less hyaluronic acid filler, which means that you have less risk of swelling or displacement down the road. As I mentioned before, in addition to PRF, I also use EZ-Gel for facial rejuvenation. I use this gel in areas like the nasolabial folds and marionette lines, your cheeks, your temples, even your lips. And the reason I use the gel in other parts of the face is because the gel is thicker, so it allows me to inject it more like a normal filler. Now, you're probably wondering, well, if you can do PRF to your eyes, why can't you do it to your face? Why do you have to do EZ-Gel to your face? You can do PRF in the face. We just don't have head-to-head studies that compare EZ-Gel, which is, very similar to PRF. So we don't have head-to-head studies comparing EZ-Gel to PRF. Anecdotally, the reason why I like to do EZ-Gel for the face and PRF for the eyes is because of the steps needed. So I have found really good results with doing PRF to the eyes, and making PRF is much simpler than making EZ-Gel. But I feel like the consistency of PRF for thicker areas of the skin, it's not as easy. So it's a little bit too liquid to inject thicker areas of the face. And so that's why I like EZ-Gel for the rest of the face. Now, if I'm doing a full facial rejuvenation with EZ-Gel and I'm already making EZ-Gel, I will definitely inject it into the tear troughs as well. But if I'm just doing tear trough injections, then I stick to PRF because it's more affordable for the patient and it is easier to make. Probably every single person can benefit from EZ-Gel or PRF injections. Some patients do need more volumization than what a natural filler can provide. So I like to tell patients, don't be scared of Botox or fillers if you want cosmetic procedures and if you want volumization. Even if you get a facelift, a facelift or neck lift, it doesn't volumize. So even if you get a facelift or neck lift, you will often need volumization either with a fat transfer or with different fillers. So don't be scared of fillers. All of these tools have their pros and cons, and it's really important to find the right injector and the right person to help you guide that decision. So what is the schedule of these treatments? When patients come in, what do I tell them? For under eyes, I do a series of 3 PRF treatments that are spaced 1 month apart. And depending what other issues patients have that are contributing to their tired look, I may combine PRF with other treatments like Tixel. Once the blood is drawn and extracted, I will then inject the PRF into the tear troughs using a cannula. A cannula is a blunt needle and it has a much lower risk of bruising. So that's why I like to use the cannula for the under eye area. Tixel is a common treatment that I mentioned before that I like to use with PRF. Tixel is not technically a laser, but it delivers heat in columns. So for patients who have skin laxity and volume loss, I will use a combination of Tixel and PRF. There is very little downtime from Tixel itself because it's not a true laser resurfacing procedure. So I'll do a combination of Tixel and PRF, which are 3 treatments spaced 1 month apart. And the combo has been incredibly effective, and I will show that in the before and after photos at the end of my video. For EZ-Gel, for facial rejuvenation, I also do a series of 3 treatments that are spaced about a month apart. And I will sometimes combine EZ-Gel with other fillers. And I know I've mentioned this before, but I think it's really important to stress that no one cosmetic tool can do everything. And so that's why we need to use a combination of different tools we have in our arsenal to provide the best outcome. Are the results permanent? So while patients do see some improvement during the treatments, you will see the most improvement usually 3 months after the last treatment. And that's because collagen production takes time and you have to be patient. The collagen that you end up making, it is is yours to keep. It is permanent. But we do continue losing collagen as we get older. A lot of dermatologists like to quote that we start losing 1% of our collagen starting in our 20s. I don't think that it's just a linear loss, that's correlated with age. I think that we age in spurts. For example, if you had a stressful event or your lifestyle change, or you had a health crisis, you might age more in that 1 year and then just be a little stagnant for some time until another event that makes you age. So I don't think we age linearly, but on average, we do lose some amount of collagen every year. And so patients will need maintenance treatments with their PRF or EZ-Gel about once a year to once every 2 years. So what are the pros and cons of EZ-Gel or PRF? The benefits are that 1, like I've talked about, it's natural. 2, it doesn't cause any swelling because there's no water retention. So you're not likely to look overdone or look like you really had anything done with PRF or EZ-Gel. It has a very low downtime, so if I am injecting PRF under your eyes, you have downtime for about 3 to 5 days because you just have swelling where I injected it. And then for EZ-Gel, most patients don't really notice the swelling because we inject it similar to filler. Unlike other biostimulatory fillers, there is no nodule formation because there is no clumping of product that can cause an exaggerated collagen production. So there is no nodule formation, there is no swelling, there is no water retention. The results are just very natural and it is from your body. The other benefit of PRF is that, we can combine it with so many other procedures to help with tightening. By the way, if you're finding this video helpful, please comment below, like and share this video with others as well, and subscribe to my channel for deep dives into cosmetic treatments as well as skincare. The downsides of PRF is that you need multiple treatments. So like I said, you need at least, 3 treatments. And this is the case with any procedure that has low downtime. There is a risk of bruising because it is an injection after all, and there's a risk of bruising with any injection. The other downside is that the collagen production is unpredictable. We are relying on you to make collagen, and people make collagen at different rates. And so I can't exactly tell you what your end result will be. Whereas with hyaluronic acid fillers, we get immediate results. So immediately you'll notice improvement, but that is not the case with PRF or other biostimulatory fillers. What patients should not get PRF or EZ-Gel? So if you have a history of blood disorders like clotting disorders, low platelet count called thrombocytopenia, hemophilias, or other coagulation disorders, you're probably not a suitable candidate for EZ-Gel or PRF because you don't have the ability to clot properly or make good platelets. If you have a history of chronic liver disease, I wouldn't want to do PRF or EZ-Gel either because the platelet function is usually disrupted if you have liver disease, and even EZ-Gel, which relies on albumin is made by your liver, so you wouldn't have enough production of albumin. If you're immunosuppressed, meaning that if you have a history of HIV, Hep B or C, I don't really want to use PRF just because it hasn't really been studied in this patient population, so I'm not sure how you're going to react. And this is the same with pregnancy. And usually with pregnancy, we don't want to do any elective cosmetic procedures because it's not studied in pregnancy. So finally, what you've been waiting for, let's look through some patient studies. So if you look at this particular patient, she is a longtime patient of mine, and she was always bothered by how tired her eyes looked. And in the before photo, you notice that she does have kind of an under eye circle component with a little bit of melanin in there. She also has a tiered trough, meaning there's a bit of hollowness, as well as some fine lines in the area. So I did a combination of 3 PRF treatments and 2 Tixel treatments, and she actually underwent 1 more Tixel treatment afterwards, as well as a few other procedures. But this before and after is that with 3 PRF and 2 Tixels. And while there is a little bit of a difference in the lighting between the 2 photos, you can still appreciate how much better her fine lines are, as well as the discoloration, and the hollowness is almost gone with the PRF treatment. Finally, these last 2 patients were actually my first PRF patients. This patient, she got only 2 PRF treatments. I didn't do anything else as I was still kind of playing around with PRF about a year and a half ago when I first got it. You can notice an improvement in her hollowness with 2 PRF treatments. And this patient barely had any issues with his eyes, but he's one of our nurses. And so since I was trying out PRF, he was a guinea pig and let me try it on him, and just one treatment later, and this is about 2 months after the one and first treatment, you still see an improvement within the hollowness of his eyes. So there you have it. Platelet-rich fibrin, or PRF and EZ-Gel, is a great natural way to rejuvenate your face, to volumize your face, as well as the hollows under your eyes. This is a perfect example of science plus creativity kind of coming together to really help innovate the cosmetic industry. I hope this video shed some light on this really exciting and new treatment that we have within the cosmetic industry. If you have any questions or comments, please let me know below. And as always, if you're considering any cosmetic procedure, please don't sell your face to Groupon. Please see a board-certified dermatologist or plastic surgeon who does cosmetics within their practice. And make sure to subscribe to my channel, as the upcoming videos on Botox and fillers will answer a lot of common questions and address a lot of concerns, so subscribe and stay tuned. If you want to level up your understanding of other cosmetic procedures that I do in my dermatologist practice, please check out these 2 videos which go in depth into the most common procedures I do for anti-aging, skin texture, and just skin rejuvenation in general. These videos will be immensely helpful for you to understand that skincare, while it's really great, does sometimes need to be augmented with laser procedures. So thank you so much for watching this video, and I will see you in the next one.